All right, so we'll start with the factors which would affect child language acquisition. So these seem to be, I would say, some of them might seem to you, Reverend, as minor factors, but again, they have a whole lot of baggage behind them as well. So, for instance, the first one, right? Socioeconomic status. That means a child's socioeconomic status, as in the socioeconomic status of the family, right? So socioeconomic status would be a measure combining income, education, and also occupation of the parents, right? Because then that has an impact on the quantity and quality of input, right? So our children, I would say, as in if we consider a situation where children come from lower SCS household, socioeconomic status, right? So they would hear fewer words per hour, lower quantity, and also complex vocabulary, right? And also, as in the words can be harsh and all these, right? And also, I would say when it comes to the parental education, higher parental education correlates with more frequent reading to children, more sophisticated language models, and also the way that they would respond, right? Yeah. And also, again, something very much connected, quality and quantity of input. Quantity means the number of words a child hears, right? And quality means the way that the language is delivered, right? I would say so, the responses that they are given. So most importantly, this idea of responding, because sometimes you see like how some kids are ignored, right? They're not given response properly. And then bilingualism and multilingualism, right? So bilingual children may appear to have kind of a slower rate of vocabulary acquisition in each individual language when we compare with monolingual peers, right? But what would happen is when we consider their total conceptual vocabulary, because then it would combine both the language, then that would be higher, but the rate of acquisition would be a bit slow, right? And also, yeah, that means acquiring two languages from birth, right? It is different from learning a second language. We need to understand, right? So that goes under second language acquisition. But here, this one comes under first language acquisition when kind of, two or three languages are given simultaneously, right? Yeah. And also gender differences. So that would be kind of a very minor fact, right? Observe differences in language development between genders. That would be typically minor, especially in early childhood. But there is this idea kind of early onset, girls are often found to have a slightly faster rate of early language acquisition, right? Usually girls speak their first words and achieve grammatical milestones earlier. But again, these are like very minor things, right? And also, that means much more than gender, individuality has, as in the individual, I would say input that a kid is given is far more important than gender, right? Yeah. And also, there is this idea of birth order, the position of a child in the family, like firstborn, secondborn. Likewise, so firstborns often have a vocabulary advantage because their language input comes directly from adults, right? But when we consider later borns, what would happen? They receive language input from both adults and older siblings, right? But then again, there's this idea that they have kind of more time to engage with talk with their peers, as in peers in the sense they are siblings, right? So there are like both the way around. And then also cognitive abilities. So that is also important because when you consider Piaget, because we discussed about him, so the certain cognitive milestones, right? So those are seen as prerequisites for corresponding language skills. Because when a kid has kind of an intellectual disability, children with lower general cognitive abilities, what would happen? It would be slower, it would be delayed, right? So that idea is there. So in language impairment, so that is why cognition is related here. And also hearing and speech mechanisms, right? Because the auditory perception, that is crucial for language, right? So if there is a hearing loss, even a mild one can impair phonological development, the way that they would, I would say, perceive sounds, and also speech mechanisms, right? So normal function of the vocal cord should be their tongue, right? All these things are important as well. And then if we move to the next one, as in bilingual and multilingual acquisition, let me increase, not actually increase, but settle this a bit. So if we consider simultaneous bilingualism, what is it? That means bilingualism happening at the same time. We have discussed about this even in our classes as well. So that means a child is regularly exposed to two languages from birth. I have told you an example about a girl that I know, right? So she's equally fluent in both the languages. That means the child hears kind of, the processes from both languages from the beginning. So that means two distinct, but again, when you consider the larger picture, interconnected language systems side by side, right? Yeah. So one would come from either parents or else can be. So there's this idea as well when two parents belonging to different communities, that is also possible. Or else parents and the kid coming from one community and then the child is exposed to this other community at a school, that can also happen, right? And also code switching can happen, mixing elements, right? So then that is natural, that can happen, right? So that means a normal kind of a skilled behavior, not a confusion at this stage. And also language differentiation. So the children may appear to mix languages initially, but they are capable of differentiating between two systems from a very early age. That can happen, right? And also there is this idea sequential bilingualism. We have talked about it under when we were not in this course reference, but when you were doing this other course related to the second language teaching. So there we could see, so sequential bilingualism means second language is given later, right? After the first language, after the first is established. So he or she already has the basic cognitive and linguistic framework then, right? Yeah. And as in, when you consider like both these things, there are advantages because sometimes you can see there are some myths or misconceptions. So one thing would be language confusion. People say, no, don't give both languages together. Like they would be confused. And it is not like that. Children are not confused, right? They possess two distinct linguistic systems, I would say, and they're skilled at managing the input, right? Code switching would be something functional, kind of a pragmatic, practical strategy. And then cognitive benefits. And it is a fact, right? So bilingualism is linked to significant cognitive benefits. So that means superior executive skills, attention focus, problem solving, and task switching. So the girl that I told you, this little girl, she's around 7 years now. She's very fast and she's very practical. She has a whole lot of empathy, right? Yeah, so there you can see. And also this side of delay concerns, because again a myth, right? Because people say, oh, bilingualism does not kind of, cause language delay. You cannot say that it causes language delay. So bilingualism causing language delay would be a myth. It doesn't happen, right? So it can be, a vocabulary can be like in one language might be smaller than a monolingual one, but the total vocabulary is usually greater, right? So because of that, you don't have to kind of, think that kind of, this delay concern as a fact. It is a myth, right? Yeah. So that's it. And also, if we consider about a typical language development, right? So what are a typical language development? So that is again something important. There are all these concepts that we need to pay attention to, right? A specific language impairment is there. So there are two words that you are given here. So here that means a diagnosis for children who have significant difficulties with language development, right? So that means can be intellectual develop kind of, disability, sensory impairment, can be hearing loss, right? Or neurological damages, something is wrong with uh, neurons, and as in the neurological aspect that can happen, nerves. And also there can be autism, right? So again a neurodevelopmental condition, right? And there are also, you can see, so when it comes to language development in ASD, it is kind of variable. Some can be non-verbal, other have a strong vocabulary but struggle with pragmatic. So I know this boy with autism. He is someone who's very, I would say, he has a very fast brain. His brain works very fast, but he doesn't have this pragmatic use of language. Practically, to use the language practically, he doesn't know, right? And also, there can be repetitions, right? And they have difficulties with back and forth conversation. He doesn't know like how to continue a conversation. He would repeat the same thing, right? He would force people to do kind of, play with him and all this. Is around, I think, now 18 or something, but he has the not the brain, the behavior of a kid, I would say, right? But he speaks faster, likewise, there you can see, and then he has a very good memory power. But the unfortunate thing is he cannot put it to use, right? So that issue is there. And then you have all these hearing impairment effects, right? So that means like hearing loss, literally, you can understand it. Hearing loss literally interferes with the brain's ability to receive all these phonological input, right? Speech sounds. So then the hearing speech sounds is something very much important for language development. And that won't happen when a person is, I would say, impaired in his or her this hearing aspect. And then also there can be development delays, right? When a child does not reach developmental milestones at the expected age range. So again, I have an example to give you. There was this boy. So he had this idea, so he had this concern. There was a developmental delay. And then one doctor once told these parents, so they were like so worried about this boy. And then the doctors told them, don't worry, because when your son is 10 years older, the fact that he's behaving like a 5 is problematic. And when your son is 15, the fact that he's behaving like a 10 years old is problematic. But just think, when he is 25, the fact that he's behaving like a 20 years old is not a problem. Likewise, there's a slow rate, but when he reaches maturity, so it would be delayed by like 5 years, but then it won't be an issue, right? So I hope you understand the point that I'm trying to make here, as in the point that the doctors made here, they are. So likewise, right? So they consider, so the child is simply as a late bloomer. The gap closes one day, right? So then there you can see the language delay would happen, but he would get the language, right? So likewise, so there you can see. And if we consider the early identification, so like how to identify potential language issues as early as possible. So when it comes to like 12 to 18 months, so they won't kind of, come up with no first, I would say, first words, right? So they won't point or use point as into different objects, and also they won't use gestures to communicate. And also when it comes to 24 months, that means like 1 year, they would still use around 50 words, right? So likewise, they would find it difficult to understand simple directions, right? Speech is unintelligible to strangers, that means strangers won't understand the language, and difficulties with grammar, right? So these things, right? And if we consider this importance of intervention, that means there's this idea. So it is important to, as in, close the gap. So therapy should be given, medicine should be given. That is the idea, right? So that means language skills are the foundation for literacy. So because of that, language skills should be given. So those are the important things that we need to understand here. Right. So today we are going to look at a different aspect of first language acquisition. We have been doing these language acquisition lecture series on different aspect of first language acquisition, and today it is going to take a new turn because it is about how the children with intellectual disabilities acquire their first language, right? So, if we talk about this current terminology and then move to the definition, so the preferred current term in professional and clinical contexts would be intellectual disability, right? ID. So this term differently abled is also used, but here as we are specifically referring to the first language acquisition, we need to understand this as some sort of, I would say, a different context, right? Yeah. So here there is this idea that there are significant limitations in both intellectual functioning and adaptive behavior in such children, right? So this is no way, I would say, a discrimination towards such children, right? So here we are trying to understand the limitations and how we can cater to those, right? Yeah. So here we can find the originating point during the developmental period, right? So by developmental period, you can consider the time period before age 18. So this diagnosis requires IQ typically below 70 to 75, right? So here as the first part, you can see cognitive delay and impairment. So that means there is this slower than typical development of cognitive skills, right? So that is what meant by this cognitive delay or impairment. And then also developmental disability. So that would be a broader umbrella term that includes ID as well, right? So there is this idea that it can encompasses various conditions affecting physical, learning, language, or behavioral development, and that can appear before age 22, and that would typically last, I would say, throughout life, right? So all these conditions like autism spectrum disorder, Down syndrome, right? We will talk about these things in detail as well. I'm just giving an introduction here. And earlier, there was this term mental retardation, but it is no longer used professionally, right? Because all these terms, and there are some other terms as well, I'm not going to go into details because those are considered offensive and inappropriate, right? So sometimes even this term intellectual disability might change in future, right? Indicating that it is again something like, being differently able to do something, it can also change, right? Because language shapes attitudes and societal perceptions, right? So because of that, when you say kind of, retarded and such words, so those can sound very, I would say, discriminatory, right? Okay. And then if we move to the classification level, right? So there are several classification levels. So we will go through them one by one, right? So mid, moderate, severe, and profound, right? Yeah. So let me move to that slide. There you can see, right? So they are, if we refer to this IQ 50 to 70, so that represents approximately 85% of individuals with ID. They can develop academic skills to around sixth grade level, right? So they can achieve social and vocational adequacy, but with appropriate support. They can live independently with minimal support in adulthood, not without support, but with minimal support. So here again, we are making kind of a general claim, right? And then again, moderate IQ 35 to 50. So then it would be around 10%. They can develop academic skills up to second grade level, right? So they can learn functional communication, as in basic communication and self-care skills, right? And they can live a semi-independent living, not an independent living, again with moderate support. Then we have IQ 20 to 35, 3 to 4% of individuals. So limited speech development can use simple phrases, alternative communication, right? They can learn basic self-care, right? Likewise. And then if it is IQ below 20, 1 to 2% of individuals, like minimal verbal communication, can understand simple commands, right? But they need continuous support for all activities of daily living. 20 to 35 would require ongoing supervision and support throughout life. So they have, when it comes to IQ below 20, continuous support for everything is needed, right? Yeah. And then if we refer to the diagnostic criteria, how can we identify such a kid, right? So that would be identified specifically with defects in intellectual functioning. That means unable to reason properly, problem solving abilities are not high, right? And also defects in abstract thinking, understanding, academic learning, right? Those things. And also defects in adaptive functioning. That means so limit functioning in as in one or more activities in daily life across several environments. Let's consider home and school, right? So likewise, so regarding money, time and number, language, self-direction, such things, it is difficult. So personal care, right? Eating, dressing and hygiene, such things. And so to kind of, onset during development period means defects must manifest before age 18, right? So this distinguishes ID from acquired cognitive impairment. So acquired cognitive impairments means traumatic brain injury, dementia, such things, right? So that means there is a difference. Those are acquired things. These are from birth, right? So if early kind of, identification can be done, that would allow for timely intervention and support as well, right? Yeah. So there you can see. If we consider the overall pattern in life, right? So how this would affect. So there you can see there is a delay, right? Delay rather than deviant development. So that means it won't kind of, develop like as of a normal child. So I'm not kind of, referring to it as any discriminatory term. I repeat throughout this lesson, right? So children with ID generally follow the same development trajectory as typically developing children. So the key difference would be timing and rate, not the sequence or the nature of acquisition. That means the way of acquisition, right? So there you can see. And also there is this similar development sequence, right? As typical developing children. So progress through the same stages, babbling, first words, two-word combinations, complex sentences, right? Phonological development would follow again typical patterns. That means easier sounds would be learned before more complex ones. Semantic categories emerge in similar order, objects before actions, likewise, and such things. But there would be a slower rate of acquisition, right? So when you consider the language milestones, those are achieved significantly later than the chronological age expectation. So first words may appear 2 to 3 years instead of 12 months. Two-word combinations around 3 years instead of, like 18 months. Likewise, you can observe that. And also, if we consider this idea of lower levels of complexity, right? So, maximum language ability is reached maybe below age appropriate expectation. So, not the expected level of, I would say, 15 years old child, likewise, right? So that idea is there. So those with moderate to severe ID, they might kind of, create simple sentence structures likewise. So vocabulary growth may slow, stabilize at a certain level. And also there is this wide individual variability as well. So that means language abilities differ enormously even among children with similar ICO scores, right? So some children show relative strengths in language compared to other cognitive domains. Others may have language as an area of kind of a specific weakness, right? And also when you compare and contrast, so one of the most common things would be Down syndrome. So Down syndrome shows different profile than Williams syndrome. I'm not going to go into details because those are not very much related, but here I'm giving you an example here, right? And also environmental factors like language, exposure, intervention, quality, like if you give this full support to this type of a child, and also if family support is given likewise, those things are important there. And then if we consider the next part, meet intellectual disability and their characteristics, right? So there you can say. So yes. So language delay typically kind of, 1 to 3 years behind peers. So first words would emerge around 18 to 36, right? Not 12 months. And then complex sentence by 5 to 7 years, not as in when it comes to a typical kid, it would be 3 to 4 years. Likewise, there is this gap. And then gap tends to widen with age as linguistic complexity increases, right? And also they can develop functional communication skills. That means can achieve conversational competence for everyday interactions, can express needs, wants, feelings, and able to engage in social exchanges, maintain topics, and also they can tell simple narratives and describe events. Such things can be done. Right? And also they can achieve basic literacy. Reading skills typically reach third to sixth grade level. They can decode simple text. Functional reading would happen, right? Yeah. And also vocabulary would range from 500 to 2000 plus words by adulthood. So vocabulary size again varies based on opportunities and intervention. But concrete and high frequency words would be acquired more easily. So abstract concepts like time, emotion, such things would remain challenging, right? So those are like the most important things that we need to consider regarding mid intellectual disability characteristics, right? Now, if we refer to the next part, which would be the specific features. So they can create simple sentence structures, right? So they would predominate. That means primary reliance on subject verb object constructions, like, she likes dogs likewise. And also they would use coordinating conjunctions like and but more than subordinating conjunctions, right? So because coordinating conjunctions like and but are more easy and more kind of, they are familiar with, they usually kind of tend to hear them more common than words like subordinating conjunctions such as because and although, right? Yeah. So limited use of compound and complex sentences as well. So there you can see the change. And also difficulty with complex grammar, right? So let's say the boy who is wearing the red shirt, so that would say, he would say the boy has a red shirt, something like that, right? So not kind of a very complex embedded, I would say, like relative clauses, but just simple embedded clause would be used, right? Yeah. And then again, passive voice. Active voice would be strongly preferred because it is easier to use active voice, right? So passive constructions might be misunderstood or misproduced. And also when you consider other complex structures like conditionals, also they would image later, and also they may remain unfulfilled, right? And then concrete vocabulary, so that means those can be strongly acquired observable concepts like objects, actions, labels for everyday items, familiar places, right? Visual and experiential vocabulary, those would be more accessible. Such things are there. And then they would find abstract concepts to be challenging, right? Like time related concepts, yesterday, tomorrow, those things. And then also emotional vocabulary, as in limited beyond basic terms like happy and sad, of course, right? And also mental state verbs like know, remember, those things, yeah. And even figurative language, those things would be difficult in terms of abstract concepts, right? and also pragmatic skills. So that means social communication even functions as a kind of a, there's this idea, relative strength, right? So they would be able to initiate and maintain conversations on familiar topics. They would learn how to do turn taking, use of politeness markers, and nonverbal communication. So those they can, of course, I would say assimilate. And also, yeah, as we discussed, can participate in conversations with support, with scaffolding, right? Yeah, so that is there. And if we refer to the next part, moderate intellectual disability characteristics. So, when we consider this moderate ID, language delay would happen typically 3 to 5 years, right? So, again, we need to look at it in kind of a comparative perspective as well. Yeah, so first words may not appear until 3 to 5 years, and two words combinations around 4 to 6, simple sentences by 7 to 10, right? And then, yeah, so that can happen. And also, significant gap between understanding and expressive language, as in simply, if we consider it, language and as in understanding and speaking the language, right? Yeah. And also their functional communication is possible, so they can communicate basic needs, wants, and simple ideas, can understand, can respond to everyday contexts, and communication would be kind of heavily context dependent, can use kind of little words and short phrases, right? Can follow simple concrete instructions. But again, what would happen, it would be limited, because limited ability to discuss non-present events, so abstract ideas, right? So usually storytelling and narrative skills, those things they won't be armed with. And then vocabulary would typically like from 200 to 1000 words, right? So that means based on intervention and opportunities. So there is this wide difference. And the core vocabulary would focus on immediate environment, daily routines, and also concrete nouns would dominate, like food items, right? Common objects, such things, that things you can see day to day life, right? And basic action verbs can be used, right? So such things can be seen. And heavy reliance on gestures and argumentative communication, right? So natural gestures, and as in those would be used as a supplement for verbal communication. They would point, they would show, nod, right? Yeah, so there you can see. And also regarding argumentative and alternative communication, so like there's this idea like picture communication, right? And sign language, those things would be preferred. And then if we further move to the specific linguistic features, right? Yeah, so there are also, you can see predominantly it would be like 2 to 3 utterances, not much, right? And in terms of morphology, right? So there are also, you can see, so where are these? Yes. Yes, so they are also, you can see. So that means grammatical morphemes, as in morphological development is also like that. Irregular forms are rarely mastered, regular forms are preferred, right? Yeah. And also, uh, again, pronouns, tenses, and plural. So when it comes to tenses, there are several that rules, I would say several rules that the student has to learn. So even typical kids find them to be difficult, and no wonder here that you can see this situation, right? Yeah. Yes. All right, yeah. So there you can see, right? Yes. And when we were talking about this idea, yes, grammatical morphemes as well, and then pronouns, tenses, and plurals. So present tense would be easier for them to use. So present tense would dominate definitely. Minimal past and future tense marking would be used. And yes. And then here ekalia means repeating what was just said, right? So ekalia, that would happen because uh, they would tend to kind of, imitate and then kind of somehow pronounce that word. And also comprehensive better than production, right? So comprehension would be better. That means they can comprehend well, but not much produced, right? Yeah. And then it would be again comprehension, even though it is better than production, it can also be very much limited, right? So because understanding again heavily dependent on context as well. And then, yeah, so then again, they would come across with this topic maintenance difficulties. Their conversations would be brief. It would be difficult for them to produce some words, right? So that issue is also there. So difficulty with conversational repair when communication kind of, stops and all these. That is also there. Right. Okay. Then if we refer to severe intellectual disability, right? So then what would happen? Yeah. So there would be this minimal verbal language development. That means language limitation would be there. A very small vocabulary, like 20 to 200 words, right? And those would also consist mostly of just one word or short phrases, minimal overall verbal development. And also communication dependence would happen because they would focus on heavy dependence on nonverbal. Here you can see, right? So like gestures, facial expressions, basic science likewise. And also it is difficult to understand somewhat, right? So difficulty with complex language, but kind of a better ability, right, to respond to simple commands and familiar routines because they are used to those, right? And also if we consider this idea of verbal tendency, right? So that means, there's this and the repeating words and phrases would be heard. So that applies to all these people in, I would say, all these post-colonial countries. And if we move to profound, yeah, okay. Give me a minute. Yeah. So there you can see, right? Yeah. So how they would respond to all this familiar used to stuff. And then, if we refer to the profound intellectual disability awareness, as in this disability, right? So here, there you can see there would be very limited, right, or no verbal language. That means his speech is typically absent or extremely minimal, so requiring complete reliance on alternative methods. And also primarily pre-linguistic. So that means communication is usually that would happen through involuntary or reflexive behaviors like crying, changes in body tension, gaze, right, as in eye gaze, simple vocalization, such things. And also there is this risk that they may not develop symbolic language, right? They may not grasp that a picture, sign, or a spoken word can represent kind of, a real object or a concept they would not understand, right? Yeah, so that is also there. And then, and also if we kind of talk about like how to support such kids, so constant observation should happen, right? Caregivers must become literally detectives to interpret the individual signs, right? Yeah, so such things are there. And then, if we move to this, I would say communication toolkit, right? Yeah. So that means like how these methods can be used, right? So one would be as in like how they would use these methods to communicate. So one would be vocalization. So includes kind of, all these activities like crying and laughing. So here the important thing is that it should be discerned, like why the sound is occurring. Is it the cry pain or hunger? Likewise. And then eye gaze, right? So that means interpreting where the gaze is directed, right? And then body movements, that means differentiating between random movements, right? So what is this as any intentional rejection or something else? And then facial expressions, right? Yeah. So how these would kind of, change, and also response to sensory stimuli. So they kind of, observe reactions to light and touch and sound, right? Yeah. So there you can see. And then after that, we can see, yeah, intervention focus, right? And then the last slide. So here it is very important to have intellectual communication. That means to move the individual from reflexive or automatic reactions like crying and being uncomfortable to a behavior which is constantly and kind of reliably directed at a partner, right? So that is important. And then choice making, right? To provide the individual with agency and control over their environment, right? Yes. And also expressing preferences to clearly communicate likes and dislikes, whether I like this or not, saying at least yes or no. And then basic needs communication, that means to kind of replace general distress with a specific reliable signal for core needs like being in pain, right? Hunger and such things. So that means kind of a simple individualized system where these key non-verbal signals are understood by everyone across all care settings, that can be done, right? So that was about first language acquisition in children with intellectual disabilities, right? Yeah. Okay. So that brings us to the end of this very long lecture series on first language acquisition.